Welcome to the Montgomery County Council's Tuesday, June 9th meeting. I'm going to begin today with silence. It will be for 8 minutes and 46 seconds. And it is for all of us to remember George Floyd and how he was murdered and the need for social and racial justice. Thank you. Your thoughts and your prayers are with Mr. Floyd's family and all who are suffering. I now would like to call on Councilmember Glaze.
Thank you, Mr. President, for this moment of personal privilege and for allowing us to honor the memory of George Floyd. This moment, these rallies and protests, the honest conversations we've had and will continue to have about how Black Lives Matter are extremely important. And our role as a council is to ensure that every resident feels safe to live here without fear or harm. And it is in that spirit that yesterday the county executive and I raised the pride flag here in Rockville to express our support for members of the LGBTQ plus community who also want to live here without fear or harm. And it is that intersectionality of this moment made even more poignant by the fact that the LGBTQ rights movement essentially began 51 years ago when the New York Police Department stormed into the Stonewall Inn, arresting mostly gay men of color and Black trans women. And that was the start of the modern LGBTQ rights movement. And so if we fast forward to today, I want to take a moment to recognize one of our local LGBTQ plus heroes, someone who's been extremely busy in our community over the last number of months, keeping us safe and healthy from COVID-19. And he is our Chief Health Officer, Dr. Travis Gales. Dr. Gales has been working around the clock to protect our community and those who have been disproportionately affected by this pandemic, who we know to be Black and brown residents of our community. And so I want to commend Dr. Gales for his incredible leadership in the public health sector with his impressive command of the county's public health services. You know, Dr. Gales epitomizes the definition of a hero. He's a member of the LGBTQ plus community and a role model for residents throughout the county and beyond. And so Dr. Gales, I just want to thank you for everything that you are doing, for everything that you will continue to do, and doing it all while being genuinely you. So Dr. Gales, thank you very much.
Thank you. It's an honor and a privilege. We hang out all the time, and I'm going to be hanging out with you probably in about 20 more minutes in a different capacity. So thank you, Councilmember Glaze. Your words highlighted a lot of things. You know, there's a lot of stuff going on in the world right now. And in addition to everything that's happening, as we've talked about before, I try to make sure that in my space that I take up professionally and personally, I give voice to many of those individuals who don't have representation at the table. And I think it's important, given your reference to the Stonewall riots being led by a large number of Black trans women, it's important to highlight that there is an epidemic of violence being perpetuated against trans women of color across this country that has not received a lot of attention, has not received a lot of action. So I don't know everyone's name who's been impacted by that, but I speak all of their names in this space today and hope that they can be also a part of the conversation as we move forward in terms of the application of justice and the application of safety and protecting all of the residents in our community. And the last thing I'll say is the spaces that we take up, people are watching, and there are people who are looking to us to provide guidance. And something that my grandparents taught me as a kid is you never know who is paying attention and looking at what you're doing, and you never know what impact you might have on them. And so it's important that we do take up our space and we use it responsibly. And I think of several decades ago, there was an athlete, I won't call him out because he has done a lot in terms of rights and advocacy recently, but he said, you know, I'm no one's role model. That's actually not true. Whether we like it or not, we are role models, and we don't know who's paying attention and looking and saying, I see someone who looks like me, someone who talks like me, someone who loves like me, and you have no idea how potentially impactful that can be to inspire someone else. So thank you again. It's an honor. Again, I know we'll be talking again shortly in a different capacity, but thank you again. I appreciate it. Very humble.
Thank you both Councilmember Glaze and Dr. Gales. And we will see, well, we're going to see Councilmember Glaze along the way. We'll see you in a few moments. Thank you, Dr. Gales. And with that, Madam Clerk, do we have any announcements or changes to the agenda or petitions?
Yes, good morning, Council President and Council members. We have announcements under general business. The report and recommendation of the Charter Review Commission will be presented to the Council on June 23rd, 2020. The Council will conduct a public hearing on these recommendations and other proposed charter amendments on July 7th, 2020 at 1:30 p.m. The Council will hold a public hearing on Bill 720, the Interagency Commission on Homelessness, Membership and Duties, on June 16th, 2020 at 1:30 p.m. This was rescheduled from a session on March 17, 2020. The Council is seeking applicants for the Policing Advisory Commission. The deadline is June 19, 2020 at 5 p.m. We have a petition from the residents of Montgomery County. A petition from residents of Montgomery County supporting reallocation of the Montgomery County Police Department budget and the need for police reform. In addition, we have a couple of amendments. So we have an addendum to the consent calendar, item 3I, an introduction, special appropriation to the county government's FY20 operating budget, Maryland Tech Council support for COVID-19 response, $250,000, the Business Continuity Task Force, source of funds, General Fund Reserve. What has been added are the lead sponsors, Council members Reamer, Katz, Albernos, Friedson, Glass, and Navarro. The public hearing action will be scheduled at a future date. Also added to the consent calendar, 3J, introduction, special appropriation to the county government's FY operating budget, Montgomery County Economic Development Corporation non-departmental account, support for COVID-19 response, $500,000 for 3R initiative, source of funds, general fund reserves, lead sponsor is the county council. Public hearing action will be scheduled at a future date. Also added 3K, introduction, special appropriation to the county government's FY operating budget, early care and education non-departmental account, COVID-19 Early Care and Education Initiative Recovery Fund, $10 million. Source of funds, General Fund Reserves. Lead sponsors, Council members Navarro, Friedson, and Reamer. Public hearing action will be scheduled for June 16th, 2020. Also added immediately following this council session today, a proposed closed session to discuss the appointment, employment, assignment, promotion, discipline, demotion, compensation, removal, resignation, or performance evaluation of an appointee, employee, or official over whom it has jurisdiction, pursuant to Maryland Code General Provisions, Article Section 3-305, B1I. Topic is personal matter concerning one or more employees. That is all, Council President.
Thank you very much. We have the minutes for the closed session of May 6, 2020 has been distributed. Unless there are any corrections, they will be approved as received. Next is our consent calendar. Is there a motion?
So moved.
It's been moved by Councilmember Rice, seconded by Councilmember Friedson. And Councilmember Rice would like to speak, please.
Well, thank you very much, Mr. President. I'd like to be added as a co-sponsor to item I and to item K, please.
Okay, thank you very much. Councilmember Navarro.
Thank you, Mr. President. I would like to speak on item K and also H. Specifically, I want to thank Councilmember Friedson and Reamer, as well as staff from the executive, specifically HHS, in this whirlwind attempt at combining actually two special appropriations. And I do want to say to my colleagues that, we have, I think, very nicely worked very collaboratively on all of these particular special appropriations. This one in particular, we were literally until yesterday super late finalizing a lot of the details. If not, obviously we would have circulated it to all of you, because I know that all of you care so much about early care and education, specifically childcare. But this definitely is, an attempt to give a shot in the arm to our childcare sector as we are discussing reopening the county. Of course, having access to quality, affordable, geographically accessible childcare is going to be a key component. Can only imagine the stress that parents are actually experiencing as things begin to reopen and they have to go back to work, and the notion that maybe your childcare arrangement is no longer there. And so to not only deal with the stress of children being at home all this time, but then having to make a change in your childcare arrangement, it's something that I know personally is extraordinarily stressful. So what we're doing here, again, we're combining the special appropriation that the county executive has sent over with our own, and it's pretty straightforward. I mean, it provides funds for childcare, both centers and family childcare programs, to be able to address losses, but also to be able to have operating funds for at least a month, as well as funds for them to be COVID-19 ready in terms of things like PPE, or if you have to rearrange of, different kinds of obviously techniques that you need to implement in order to be safe and provide that kind of safe care. And so it is a total of $10 million. We do know that there are $2 million in the early care and education initiatives budget that will also be used for this effort. So in total is $12 million. And again, I want to thank staff who worked so hard. I want to thank Berta Sosimo from my office, who worked really hard with Vivian Yao, as well as Rose from Councilmember Friedson's office, and Ken Silverman as well, and everybody who just really quickly merged these two particular special appropriations. So thank you so much for that. And I did want to also point out that we have 3H, which is a release of 4 papers. These are recovery outlook papers from the Office of Legislative Oversight. As you recall, it was something that I felt very strongly and proposed to all of you for support to have our Office of Legislative Oversight begin to produce, to publish papers on recovery. In other words, so that we can all have in-depth information about what this means as we reopen, as we recover. What does this all mean for our county? And they have just released office and industrial commercial real estate, telework and economic development, public transit in a pandemic environment, and commercial real estate hospitality sector. So these papers will hopefully guide all of us in these particular areas as we are now looking at and seeking reopening in a gradual manner. With that, I also thank Councilmember Reamer for the special appropriation for the COVID-19 support and response for Business Continuity Task Force. I think that's a really awesome special appropriation as well. Thank you.
Thank you. And I too would like to be added as a co-sponsor for item K, please. Next is Councilmember Reamer.
Thank you, Council President. Just wanted to provide a brief overview of the 2 items that are being introduced today on the economic development front. Thank you to my colleagues for working with me to get them done. It's possible that there are council members who expressed their support and are not listed as sponsors because things were just, there's a lot of email going around. I apologize. I know Councilmember Rice, for example. So the first one, item I, is a program that is intended to support the Maryland Technology Council and its efforts to bring together the tech sector, the life science sector, all of the business entities that are kind of in that orbit with new resources, executive mentorship, venture capital, all kinds of networking access to help those companies pivot, rebound, or grow in this really unusual moment. And the organization has been providing this service for some time. What we're trying to do here is get them to do a lot more in Montgomery County. It's a statewide program. We have a really big base for them to work from here. And I'm excited that they came to us and said, we could really expand this and help leverage the strength of your private sector networks here. Over the years, they've raised tens of millions of dollars indirectly through this program by bringing together, capital and executive leadership at the companies. So it's a modest investment here. It's not providing actual grant funding, unlike some of our other programs. It's really seeking to leverage private sector resources and capital. So I just really want to thank, again, my colleagues for coming on board to help us move this forward. And we will take this up at committee. You'll get a good chance to hear from the Maryland Tech Council. And I know that the executive branch has a mission group that is aligned with this kind of vision. So we'll hear more about how they can fit together. The second item is really one that's kind of growing out of all of our work together around restaurants and reopening. We have a proposal here to create a fund, relaunch, reopen, re-envision, reimagine, that I really want to thank Ben Wu and Sarah Miller at the Economic Development Corporation for helping to conceive. It really started with a call that we had in our business recovery group call with our regional directors who are doing a lot of work on the ground. I know many of my colleagues are on that. Craig Rice was on that call. I believe Andrew, Councilmember Jawanda, many of us were on the call. And we heard about the exciting plans that are already in implementation in Bethesda with creating outdoor space to support the restaurant sector there. As well as we heard about a way of providing support to businesses there through contractual service with a retail brokerage marketing firm. And so the question that I had asked was, this sounds like a really good idea. Couldn't we bring that around the county as well? And everyone seemed really interested in that. And then the Economic Development Corporation has identified a corporate sponsor that they believe will be willing to provide some support into this. And so we've expanded the vision here. We're working with the regional directors. So the regional directors will be providing the outreach on the ground to ensure that we are able to bring this kind of support for direct consultation about how a retail or a restaurant can get back on its feet, as well as a small grant fund for certain expenses that are related to relaunching. And again, I think our idea here is let's get into the strip centers in White Oak and in Aspen Hill and in Germantown. Let's figure out how to create a vibrant outdoor economy in this new environment. So Councilmember Friedson, who has really been very helpful supporting this, has also identified the possibility for using funding from the Telework Fund, which has some remaining funding. So I'm pretty optimistic that this will not actually require a net of our envisioned appropriations, because we'll be ultimately relying upon an earlier appropriation from the county. But it's $500,000 from the EDC, which would be matched from us, which would be matched by $250 from the EDC and hopefully $250 from a corporate sponsor. So thank you to my colleagues, and I want to thank Councilmember Navarro for taking the lead on the childcare initiative, and Councilmember Friedson for his work there as well. It's great to have two teammates to rely upon there. I really I think we have to think about our childcare providers the same way we think about our schools. and we need to ensure that they're there to support our reopening. So, thank you so much.
Thank you, Vice President Hucker.
Thank you, Mr. President. I too would like to be added as a co-sponsor of item I. Thank you, Councilmember Reamer and all the lead sponsors for your leadership on that. Councilmember, I'm also grateful for and agree with everything you said about item J and mentioning White Oak. That sounds like a great initiative. And I'm grateful to Councilmembers Navarro, Friedson, and Reamer for the leadership on childcare. Childcare obviously is so vital, not just to training our next generation, but to the reopening in particular. And even the best run centers run on the thinnest of margins under the best of circumstances. So it's really vital that we're putting this in place. So I'd like to be added as co-sponsor, and thank you for your leadership.
Thank you very much. Councilmember Friedson.
Thank you to colleagues. Thank you, Council President. I first of all wanted to congratulate all of those who are being appointed today. I don't want that to get lost. So congratulations for that. We have a number of terrific appointments on the consent calendar where we took a lot of time speaking about some of those and interviewing those. So congratulations, including Barry Kaplan, who's being appointed to the investment trustees. And we had a good interview with him, which seems like years ago, but was only a couple of weeks ago. And I also wanted to particularly highlight items I, J, and K, as we've heard. Thank you to Councilmember Reamer and the Fed chair for really taking the lead and continuing his leadership on the tech sector, and making sure that this is a key part of our economic strategy and our revitalization strategy. And item J, the 3R initiative, really proud of the work that's been done there with the Economic Development Corporation and Councilmember Reamer. Happy to have been able to help a little bit on that, and happy in particular to be able to take the some of the successes that we're starting to see in Bethesda. We're opening the Streetery tomorrow in a number of parts of Bethesda, and taking what has worked with the Bethesda Urban Partnership, working with the Regional Services Center, working with the local chamber, working with local restaurants, bringing in some private technical expertise to be able to help retailers and restaurants who individually would not have been able to access some of that expertise, and being able to bottle that up and spread that around the county. We posted it when it was announced over the weekend. It's been overwhelming in its response. And not only are we hearing from folks in Bethesda who are excited about this, and around Bethesda who are excited about this, but we're hearing from folks from all over the county saying, when are we going to see this in our part of the county? And the answer is we're working on it, and it's coming soon. And this is a key part of being able to do that, to provide the type of support that we need for the restaurants and retailers who have really been hit hard and really need our help to adjust to the new normal. We need to adjust in government to the new normal that we're asking businesses to adjust to both keep people safe and to keep their lights on and to stay in business. And then lastly, the Childcare Grants. This is a social necessity and an economic imperative. It always is in childcare, but we literally cannot reopen our economy and cannot get back anywhere close to the economic standards that support our quality of life and fund our county government and public services unless we can get childcare right. These are programs and centers that, in the best of times, in the strongest of economies, operate in very financially challenging circumstances. We've talked about it here a lot, have done a lot of work on it. Now, in the worst economic downturn that we've seen in our lifetime, and some of the most significant struggles economically that we've seen in history, we need to step up and help them. And that's what we're doing here. I think all of these are about the reopening, reimagining, and recovering of our economy, and really revitalizing our workforce and our economic standards, both for residents and businesses, for consumers and for workers. And so I think all three of these together as a package are really reflective of the next iteration of what this council has been doing from the beginning of this crisis, which is really stepping up to make sure that we can keep our friends and neighbors employed, that we can keep our businesses operating, that we can help everybody keep the lights on as best as we can, despite the massive, unprecedented challenges that they are currently facing. Really proud of the work that all of our colleagues have done on all of these different initiatives and look forward to getting them deployed and implemented as quickly, efficiently, and effectively as possible.
Thank you very much. Councilmember Albornoz.
Sorry. Thank you, Mr. President. I want to thank all of my colleagues for their hard work on all of these measures. I would like to be added as a co-sponsor to item K, the special appropriation, the operating budget for early care and education. It's clear that this is a key moving forward to ensuring economic vitality. And I want to acknowledge the leadership of Council Members Navarro, Friedson, and Reamer on this bill and all of the work that has been done by this and previous councils, specifically around early care and education for our children. And we all know that our private sector is going to be critically important in continuing to serve as a partner moving forward. And so I look forward to the discussions as we go through this process to just recognize all of the great work done by so many through the public-private partnerships that we've been able to enact, and thank organizations such as Montgomery Moving Forward and others who have done a great job in connecting key sectors for us to create a systemic issue. These funds are desperately needed to help us move forward during this unprecedented time, and also presents an opportunity for us to continue the phasing in of the strategy that was developed by our former council president in making sure that we phase in appropriately early childhood education throughout our entire county so that by the end of this, every child that needs it will have access to it. Thank you.
Thank you. Councilmember Glaze.
Thank you very much, Mr. President. I too want to thank my colleagues who've been working on the early child care and education appropriation. I've had a number of organizations reach out to me, particularly those child care centers that work in some of our churches and other within other faith communities, and I know that they are in need of this type of assistance, and so I'd like to be added as a co-sponsor and really appreciate the leadership of the three who've worked on this over the last number of weeks. Thank you.
Thank you. And I have no other speakers, but I too, though I mentioned that I want to be a co-sponsor, I too meant to mention that I sincerely appreciate all the work of my colleagues on this, especially Councilmember Navarro's lead on item K. As has been already said several times, but let me just say one more time that if we don't get child care right, we can't get the rest of the economy right. So we have got to do this properly. And with that, I've been informed that, and I know there's been a motion and a second to pass the consent calendar, but before we do that, I need a motion to suspend the rules for item C, because that's a resolution acknowledging election returns from the village of Drummond. So is there a motion to suspend the rules for item C? It was so moved by Councilmember Friedson and seconded by Councilmember Rice. Everybody's hand went up at the exact same time. All those in favor, please raise your hand. And that passes unanimously. Now we're going to vote on the motion to approve our consent calendar, and that was made by Councilmember Rice and Councilmember Friedson. All those in favor, please raise your hand, and that carries unanimously as well. Thank you very much. The next item that we have is the introduction to resolution to declare racism as a public health crisis, and Councilmember Jawando, would you like to speak on the topic?
Yes, thank you, Mr. President, and thank you to all my colleagues for all the great work that we've done in that consent calendar, helping many of our residents in many ways during this crisis. I associate myself with all the comments that have been made prior. Today, I'm pleased to introduce this resolution, along with the support of all my colleagues, declaring racism a public health crisis in Montgomery County. The resolution is tied to the social construct of race and how it affects our society in so many ways. Scientists no longer believe there is a biological basis to distinguish racial groups. Instead, they see race as a social, cultural, and political construct, wherein racial segregation and discrimination has real consequences on the health and quality of life of those impacted. Racism causes persistent discrimination and inequitable outcomes in many areas of American life. An emerging body of research, including the American Academy of Pediatrics, has found that racism itself is a social determinant of health. For over 400 years, since the first enslaved Africans arrived on our shores, racism has been at the heart of inequitable outcomes for African Americans and communities of color. And while across this nation we are rightly protesting one of the most pernicious and abhorrent forms of systemic racism, police violence. I've said it before, and I'll say it again. We die in many ways, whether it's in hospitals where Black women die giving birth at 3 times the rate of white women, regardless of their income or level of education, or because doctors don't believe we're sick when we present. Look at the case of Serena Williams, regardless of your income, or whether it's living in poorly maintained communities as a result of government-sanctioned redlining, exposing us to everything from explosions, like we saw in an apartment in Long Branch where I grew up, or environmental racism that leads to higher asthma rates and pedestrian fatalities in our communities because of lack of investment in infrastructure. And we most certainly see systemic racism in police violence, where George Floyd, who we just honored, and took 8 minutes and 46 seconds to feel not even an iota of the pain he felt as he died before our eyes and before the eyes of the nation and the world. Breonna Taylor, Robert White here in Silver Spring, Sandra Bland, Fanon Burhay, and so many other Black men and women who die at the hands of police officers at the highest rates of anyone in our nation. It's long past time we focus on the direct link to these deaths and these poor outcomes. Racism. Health disparities in particular have amplified during the COVID-19 crisis, as African Americans have the highest number of recorded cases and deaths. This is true across the United States and the state of Maryland, and in Montgomery County, where Black residents account for 1 in 4 of all COVID-19 deaths, despite only representing 19% of the population. The state of Wisconsin, Franklin County, and Cleveland, Ohio, Denver, Colorado, and Indianapolis are some of the jurisdictions that have also taken steps to declare racism a public health crisis. I want to thank all of my colleagues for their unanimous support of this resolution. As a full council, we have established a track record of promoting racial equity, social justice, and inclusion throughout the county. It's an honor to serve with each and every one of you. This resolution will build on our work, including the Racial Equity and Social Justice Act, the Law Enforcement Trust and Transparency, or LET Act, the Policing Advisory Commission Bill, the Community Policing Law, and the Remembrance and Reconciliation Commission. The resolution declaring racism a public health emergency is the next step in promoting racial equity in our county and calls upon us to urgently implement a plan and approach to eliminating systemic inequities across Montgomery County. A systemic problem requires a systemic solution. If we are ever to live up to the promise of America where everyone has the opportunity to actualize their human potential, we must understand the racism embedded in every system, in every structure, and commit to act to dismantle it, piece by piece. As one of our young student leaders said at a protest in Bethesda last week, a young white student, by the way, paraphrasing Ibram Kendi, one of our nation's leading race scholars, it is not enough to not be racist. We must be anti-racist. That takes work. It takes self-examination. It takes persistence. And it takes urgency and action. With the actions outlined in this resolution and the work we've already done, we recommit ourselves today to this important work. Thank you, Mr. President. Thank you to my colleagues.
Thank you, Councilmember. Councilmember Navarro.
Thank you, Mr. President. I want to thank Councilmember Jawanda for spearheading this resolution that declares racism for what it is, a public health crisis that must be eradicated. More importantly for me, this resolution is a reminder to all of us to the significant work that we have already committed to and that must be done. Let me just say up front, kudos to the young people who have seen in this trauma an opportunity to confront systemic and institutional racism. They have led the way in giving an urgency to the demand that Black lives matter. Mr. Floyd's death and the death of so many before him will not be in vain. If you are on social media, as many of us are, you know that Montgomery County has had its share of instances of police brutality and widely publicized deaths as a result of police action. 3 deaths come to mind. Emmanuel Okutuga, February 19th, 2011, Robert White, June 11th, 2018, and just last month, Finan Berhe, May 7th, 2020. This is not acceptable. As leaders, we owe our residents a warm and welcoming space in which they feel seen, respected, and of course, above all, safe. The current crisis has been a long time coming. We all knew that if this dysfunction was not adequately addressed, we would be faced with an uprising, the kind of which we have not seen in half a century. As a result, over 2 years ago, as a council, we began to invest in systemic efforts to reform the way we conduct the business of Montgomery County, business of work and life here in the county. In April 2018, then Councilmember Mark Elrich and I spearheaded a resolution, which was adopted by the full council, in which we committed to instituting a racial equity and social justice law. In November of 2019, the Racial Equity and Social Justice Law was unanimously adopted. Under that umbrella, we have had several laws and initiatives focused on confronting racism and bigotry in general, and in particular, police brutality in our country and in our county. These strategies' attempts at reform did not just happen overnight. We all know that racism is real, even here in Montgomery County. Many community advocates and elected officials have worked tirelessly throughout the years to eliminate disparities and address racial inequities, but racism persists. My personal motivation to passing a racial equity and social justice law was centered in the belief that racism is indeed systemic, and therefore we must pass laws that facilitate the dismantling of such system. We can do more, and we will do more. The COVID-19 pandemic violently interrupted our lives and forced us to delay the implementation of several initiatives aimed at addressing racial inequities and the root causes of what led to extrajudicial deaths in the hands of police. Mr. George Floyd's murder reminds us that this important work cannot wait. After the initial despair, I am inspired to say to our community that I, alongside each of my colleagues, will continue to work to do everything possible to make this county a safe and welcoming place. As an unapologetically proud Latina and a mom to 2 fierce Afro-Latina young women, I stand with our Black brothers and sisters. Thank you.
Thank you. Councilmember Rice.
Thank you very much, Mr. President, and thank you to my colleagues, Councilmember Duando and Councilmember Navarro, for speaking. I know that many of my colleagues are going to speak, and so I'm going to try and be brief and just share a story with you that happened on January 31st to a good friend of mine who went into a doctor's office. His wife had been persistently telling him, you need to get checked. As Black men, you don't go to the doctor as often. He called up to the office. His regular doctor wasn't available. And so they recommended another doctor. He went to that doctor, and as he walked into the office, the doctor never even looked up to acknowledge him, asked him a few standardized questions, and then became very condescending to him. At which point, my friend stopped and said, I want you to understand, I'm here because I want you to make sure that I'm okay. And the doctor at that point looked at him for the first time. He had been in the office with the doctor, you know, they're not there that long anyway, but for about 3 minutes, and the doctor had never even established eye contact with him. And he then started talking to him very condescending and had said, you know, look, you know, I don't know why you're all getting upset, and you know, you don't have to be this way. You know, I don't know why it always ends up being like this. And we know that those are code words for what oftentimes people experience when folks are asserting that because a person wants to have a certain treatment that's the same as other people, and insist on it, somehow we are now being aggressive. And so my friend left and said, look, this obviously isn't going to work. And, I don't know why you're being so disrespectful to me, left and started leaving the office. And it was at that point that I think a switch kind of flipped, and the doctor understood what he had done and what he had done wrong, and went after my friend all the way to the elevator and kept apologizing profusely, saying, please come back. I'm really, really sorry. The interesting thing about that story, and he shared this with me, is that there are so many people in our community that have this kind of experience, whether it's dealing with doctors, whether it's dealing with a person that is in a store. You guys know about the thing that happened to me, whether it's a police officer pulling you over. And when we talk about hypertension and stress, when we talk about the things that every day that people have to deal with, the simple things of going to a doctor to get a checkup, something that you pay insurance for, something that you are paying a premium for, and then are denied that just because of the color of your skin. And it's not something that's a nuanced, this is a one-off story, because keep in mind, we had a report that came out with health outcomes at the end of last year that said racism is specifically tied to the effects of Black mothers and their pregnancies, even those that are economically stable, much to the example that Councilmember Jawando said when he highlighted about Serena Williams. Folks, if we can't get this right, if we can't understand that and acknowledge the challenges that still persist, the reasons why folks have hypertension and high blood pressure and all, and they're tied directly to the systemic racism that's in our community. If we can't acknowledge that, we'll never be able to actually address the issues of George Floyd and all of the other things. I agree with Councilmember Jawando wholeheartedly. This is the beginning. This is the first in the many of steps to acknowledge the wrongs that we continue to put on our communities of color. The reality is that when people walk into a doctor's office or to any place and can't speak English, what's the first thing that folks do? Dismiss them. Dismiss them and say, okay, whatever, I can't deal with that right now. Can't you speak English? Can't you get it right? That's where we are right now, right? And so when I think about the stories that my parents told me about them growing up and what they experienced, the reality is that ain't a lot changed. It's still very much the same. In fact, it's a little bit different because back then, folks would actually say it to your face. Now they just say it to others and whisper it. And every now and then they'll say it in your face too. That's changed over the past couple of years. But the reality is that the treatment hasn't changed. The treatment is the thing that has stayed consistent, which is why we have the healthcare disparities, which is why we have all of the challenges that we do in our community, which is why we see the education gaps that we see. It's the reason why we see the economic gaps that we see. They're all attributed. They're all a part of this. So I'm very appreciative of my colleagues who have supported this. I think that, again, I hope for a time in which when I have conversations with my daughters, they tell me, they say, Dad, nobody sees race anymore. That's what they used to say. That's what they used to say. But as of these past couple of weeks, I haven't heard that coming from them anymore. We've now broken the spirit of a generation who actually thought we were on the right track. And that's something real. That's something serious that we have got to acknowledge, because we are actually making progress in terms of children thinking that they lived in a world to where they were accepted and not judged based on what they looked like. And now the articles that my daughter sends me every day of police brutality, of racism, and folks, has completely changed her outlook on society. That's scary. And if we don't do something about it, it again is going to jeopardize the very nature of everything that we fought for in this county in this state, in this nation, and in this world. It's just that big. It really is. So I really just, again, want to say thank you and know that there's plenty more work to come. Thank you, Mr. President.
Thank you. Councilmember Albornoz.
Wow. Thank you, Mr. President. There's no way I'm going to be able to say these words any better than were just stated by my colleagues, Council Members Navarro, Jawando, and Councilmember Rice. But I feel it's important to add my voice to this incredibly important subject, and I know all of my colleagues feel the same way. It is no small thing. It is very significant to acknowledge publicly and state loudly what we have known for a long time, that racism is absolutely a public health crisis both in our community and in our country. And a number of incredibly respected medical associations in the last several weeks have come out publicly to acknowledge a fact that we've known for a long time. The American Public Health Association, the Academy of Pediatrics and American Medical Association, the American College of Physicians, the American Academy of Family Physicians, and the American Psychological Association. Public health, for it to really work, needs to include important elements of medical, mental, social, economic, and educational components. All of them are intertwined. All of them are connected. You can't successfully have one without the other, and all of them are eroded by structural racism. The barriers in our healthcare system often prevent people of color from accessing necessary care due to cost, language, access, and yes, discrimination. Black and Latino people suffer disproportionately, living in densely populated urban areas with less access to green space, substandard crowded housing, and without the luxury of self-isolation, which has proven to have catastrophic impacts during this pandemic. They're relying on public transportation to be able to access the basic needs that all of us, many of us, take for granted, is something that is a critically important component for us to be able to address this moving forward. And to combat racism as a public health issue, we need to address the causes and not the symptoms. And we can't expect people who are disproportionately impacted by this structural racism to continue to adjust to that structure. We must rebuild, relook at, and completely redo the systems that have led to the structural racism that so many have been experiencing for too long. And so, as the chair of the Health and Human Services Committee, and each one of us in all of the committees that we work on, I know are going to continue to make this a priority. I'm proud to have worked with my colleagues over the last 2 years, and proud that we have set up a construct that lays the path for us to be able to move forward. But we must also acknowledge that no one program, policy, person, or initiative is going to address this completely. And it will, unfortunately, take time. But I am completely committed to ensuring the work of our committee will focus on those public health disparities. Because not only does it tragically impact those most disproportionately impacted and literally lead to life or death moments that are unnecessary and tragic, but this is a public health issue that impacts the entire community and something that all of us need to focus on. It's not just a moral obligation for us to be focusing on these issues right now. It's also a public health imperative for everyone moving forward. It's ironic and also tragic that the pandemic and the virus, and then the tragic elements that we've all been protesting against of police brutality, have come together at the same time. It right there before our very eyes, we're seeing the devastating and life or death impacts of this structural racism and the construct that we have before us. We're sometimes numb to the statistics, but the fact that our minority communities, and in particular our Black community is so disproportionately impacted by these structures. We can't continue to focus on this individually. It has to be a systemic approach. And so in very short period of time, we will be working directly with our colleagues in the Department of Health and Human Services and Dr. Raymond Crowell, and we'll be also working with Dr. Gales and our public health officers to comprehensively look at every single aspect of our public health infrastructure here in Montgomery County and how it is impacting our communities as a whole. We know that working collaboratively with our private sector, our nonprofit sector, and our public sector, we will be able to make more progress than we have been making up until now, and we'll be able to, I believe, put us in a much stronger position. This has been an extraordinarily emotional time, but one that I believe is going to make us stronger. And I have such respect and confidence in my colleagues on this body. I have enjoyed working with you over the last 2 years and very much look forward to working with you these next two to ensure that we continue a positive path forward. And I want to thank all of our county residents who have come forward and demanded to have their voices heard. You are being heard. And I just am proud of how we are going to step forward collectively as a body and know that much work needs to be done. Thank you, Mr. President, and I look forward to working with all of my colleagues to move us forward as a community.
Thank you. And I did want to announce, and we still are continuing on this topic, but the district council session, the action item about the hearing examiner's report and recommendation for local map amendment H 135 is going to be moved till this afternoon after the public hearings. So anyone that is watching, I know that they want to continue to watch, but if they're only watching for that reason, please note we're going to hear this today, but it will be after the public hearings this afternoon. And before we continue with other council members, I too just wanted to thank all of my colleagues, but especially council members Jawando and Navarro and Rice and Albernaz for their words this morning as well. But you know, as many of you know, I'm very proud of the fact that I grew up in Montgomery County. I'm very proud of that fact. And Montgomery County has always been an unbelievably wonderful place to raise family, to raise their family, and to raise, and I know for you all, to raise your families. But it's always troubled me that my lifetime, that schools were not integrated. You've heard me go through this before, and I've gotten emotional when I talk about it. But that schools were not integrated, that during my lifetime, we have seen such great changes, many of which have been very, very positive, many of which have been very, very positive, but they can't overshadow that which is not. And that is what today, and to Councilmember Jawando's resolution that he has spearheaded, and that all of us are proudly standing with him on, that is what today is all about. We understand we have come a long way, but there is so much more of this journey that we need to literally, I used to say stand shoulder to shoulder. You know, not allowed to say that exactly because of COVID-19, but we need to stand shoulder to shoulder to make certain that Montgomery County leads the way into how people should be treated and how we want everyone to feel comfortable here, because each and every person is so very important to each and every one of us. And with that, Councilmember Reamer.
I'm sorry, did you speak my name?
I did.
Thank you. Sorry, someone just came into my office to fix my air conditioning, just as you announced me. Thank you for your comments, Council President. Thank you, Councilmember Jawando, for introducing the resolution. Really appreciate your framing the issue this way. I think it is a public health emergency. It is a disease of the mind. And you know, what gives me hope when I think about racism in this country is children. You know, they see things a little differently. You know, it's always getting better when we look at the young people. But what makes me very fearful at the same time is that we have a president of the United States who is telling white people that it's good to be racist again, or it's good to be forward about your racism, I should say. And it's acceptable to no longer have self-doubt about your attitudes on race. And that is just a corrupting, corrosive, destructive, devastating reality that we're in. And I often lament, that it just feels like we were making progress towards a norm, that racism was wrong. That didn't mean that we were solving problems necessarily, but we were trying to create a norm that it's wrong. And yet now, for many people, they no longer have to fear that it's wrong. We have got to fix that. We've got to regain our footing and once again, make progress with our general social norm. The reality is we are trying to dismantle a structure that has been in this country for 400 years, as Councilmember Jawando mentioned. This country was founded with profound racist principles. Our founding documents were designed to uphold a racist institution, slavery. And, after the war, the Civil War, it was the same effects were perpetuated through other means. And we're still living with them today. It is all around us, everywhere we breathe. I mean, it's like concrete in a building. It's just everywhere we look is racism and the effect of racism. And I'd say as a white person, it's like the world outside you tries to fill you up every day with racism. And you can constantly self-reflect and be introspective and try to push it out. And then you wake up the next morning and it's coming back in. And that's just the reality of the country that we live in and the world that we live in, but especially the country that we live in. This is a country that it's just really has been devastated by racism. So the impact of it is showing up in a new way with COVID. But of course it's with us every day in 1,000 other ways. And dismantling it is going to be, a life's journey, but and it's a generational journey, but I am hopeful. I'm inspired by the multiracial protests and the sense that this is a time to, speak out and say that this country needs to embrace racial justice. And I just hope that we can come through this stronger. And I think most of the time, when bad things happen, you find some strength, you come out and you're that which does not kill you makes you stronger. And I hope it'll be a learning moment that we're in, and that 2 years from now, 5 years from now, we'll see very tangible results of the incredibly difficult times that we're in. But I do think we need to think about racism as a disease and as a public health emergency. So I strongly support the measure. Thank you.
Thank you very much, Vice President Hunker.
Thank you, Mr. President, and thank you, Will, Councilmember Jawando, for your leadership on this. This is a great step forward. It's exactly, I think, consistent with the work we did last year under Councilwoman Navarro's leadership and the Racial Equity and Social Justice Act. We're all lawmakers, and as Councilwoman Navarro said, it's going to take laws to address some of the actions, the laws and the policies and the practices that some of our predecessors have put in place for a long time. I agree with everything that my colleagues have said, but it's absolutely real work to identify the structures of structural racism and root them out. And it might be difficult, but it's fulfilling. And I'm excited to be working with all of you on that last year and this year, and to be at the stage today. I think the resolution itself is really well written. There's a lot I could call out. One thing in particular, I'm just glad that it mentions not just our employees, but our contractors, our vendors, our community partners, our grantees. We spend billions of dollars on various nonprofits and for-profits every single year. And while we expect, I think we should expect anti-racist behavior from everyone if we could get that in Montgomery County, we have a lot of leverage over the entities we spend our money on. I very much agree that we should expect them to adhere to the same precepts and values that we do for our county employees. I'm also really glad we're calling on the governor and the presiding officers of the House and Senate to take action as well. You all know that in many areas, the Overton window of policy possibilities that we can act on is circumscribed by state law, and asking them to make this declaration as well, and to do the same kind of work and engage in this, I think is absolutely appropriate and will only expand what we're able to do in the future. I think we're living generally through a great period of opportunity. I'm depressed by what Councilmember Rice had to say about what his daughters are hearing, and not surprised, but it's depressing, and it does take a long time. 23 years ago, I worked on a campaign in Minneapolis. We gathered 23,000 signatures to put the police, which were known as a problem back then, under the Civil Rights Commission. And we thought it was going to change the Minneapolis police back then. And it passed overwhelmingly on the ballot once we got all the signatures. And the Minneapolis police hasn't changed much. And Montgomery County hasn't changed enough either. It's changed a lot, but it hasn't changed enough. And I think we're engaged in a national, really a global moment where we have an opportunity to make really dramatic changes that were not even possible a few years ago. And I'm excited to be in a position with all of you to take advantage of this opportunity, and we can't miss this opportunity. So thank you.
Thank you. Councilmember Friedson.
Thank you. Thank you, Council President, and thank you to all colleagues, especially to Councilmember Jawando for leading this effort and all of your leadership on so many issues. Thank you as well to Councilmembers Rice, Navarro, and Albornoz in particular for your poignant and really powerful comments. I will try to be brief. I've really tried to listen and lift up the voices of those most impacted and to learn over these past couple weeks. And this pandemic in particular has really shown the real impacts in human lives right here in our community, and the pervasiveness of this insidious disease of institutionalized racism, and how much of an impact that it has on health outcomes and on all outcomes, quite frankly. The stories are as powerful as they are disheartening. The data is as clear as it is tragic. Racism is a destructive human invention, and so are the institutions that perpetuate it. And that's why it's up to us to confront it openly and honestly and to change it. And as a person of privilege, and as a person who has the honor of being in power, I take full responsibility of the moral obligation to confront it and to make those changes, and to listen more, to learn more, and to lift up other voices. This is an important step in the right direction. Proud to work with all of our colleagues on this council, and look forward to working on this and many other initiatives as part of this very difficult, very important, and absolutely essential conversation that we're having.
Thank you. Councilmember Glaze.
Thank you, Mr. President, and I want to thank Councilmember Jawando for his work on this, and all the other work that he's been doing and leading in the last 18 months. I do sincerely appreciate it, and I'm supportive of this, as I have been of that other important work that, at its core is trying to dismantle decades and centuries of systemic racism that's built into our laws and policies and regulations. This stuff runs deep, not only in other parts of the country, but we know it exists here too. And so we need to look at our budget. We need to figure out how we can reallocate resources to make sure that funds go to the communities in need and towards ending systemic racism and cycles of poverty. There is no debate about that. And when the hashtags stop trending and the protest signs start being put into the recycling bin, we will continue doing our work. And we need everybody who is on social media, is outside protesting, and is currently engaged in the process to remain engaged in this process. Because having this conversation about this one resolution is easy. The decisions that we will have to make this resolution and all the other policies and other resolutions that all of my wonderful colleagues have put forth before, that's when the hard work begins. And so for everybody watching and everybody who is committed to this, you need to remain committed to this, and you need to make sure that we remain committed to this. I'm committed to this. This is going to continue for a while, and hard choices will need to be made. But again, in this moment, this is the start. And so I, again, thank Councilmember Juando and all of my colleagues for committing to doing what's right and just for every resident in Montgomery County, and to make sure that Black Lives Matter. Thank you.
Thank you. Councilmember Navarro.
Thank you, Mr. President. I wanted to take a moment to clarify something, because I've been asked by constituents as well as the media. The racial equity and social justice law became effective on March 2nd of this year. The equity impact notes will become a requirement starting on August 1st. And I wanted to talk about this for a moment, because it is important for our community to be reminded that we're not walking away from that very important work we did last year, which was extremely thorough. Remember, it took King County 10 years to pass the racial equity and social justice law. We did it in a year, where we literally committed to focus on this in an extraordinary way. We had over 1,000 people participate in our community conversations. We had the amazing toolkits. We all participated in some extraordinary racial equity trainings that really, truly, addressed many of the history and the reasons why we are now facing more than ever and understanding more than ever how the systemic racist laws are still impacting things like health, for example. And I mentioned that because, when I was asked about this, people are thinking that somehow we're kind of walking away from that amazing work. And I will, until I leave public office, will constantly advocate for making sure that we are structural in nature, because we will all leave one day these seats. And unless we continue to push and make sure that these kinds of laws are enforced and are actually implemented, we will be here another 20 years. And, the late Odessa Shannon and the late Ruby Rubin come to mind for me all the time, because they were blazing a path, way before us. And, they've passed away having achieved amazing things. But also, we have to acknowledge that a lot of the same exact issues that they were fighting for back in the day, we could literally just dust off many of those letters and they're still applied today. And so this racial equity and social justice law is really important. And we are holding our first committee session on June 15th at 9:30 in the morning to hear from the executive where they are with the implementation of the law, because it did become effective in March. And we need to understand, especially in light of the information about the most impacted zip codes, which, no surprise, are the zip codes with the majority of our Black community and the majority of our Latino community reside. So I just wanted to mention that again, because, I've gotten a lot of questions. This work that we're doing, this resolution that Councilmember Juando has introduced, everything else that we're going to do, we have put in place this very thorough process to make sure that we methodically and systematically address the policies as well as the budget. And Councilmember Glaze brought that up. No doubt we're going to have to make some extraordinary decisions, but we will do it facing the data, and we will do it within the framework of this law. And hopefully it is just my hope that we will begin to see some real lasting shifts, changes that we can track with data that will live on, and that the next generation of leaders that will sit in these seats will then build upon for once and for all. So just wanted to take that moment. I appreciate Council President and Councilmember Joanna to just clarify that, because the media has been specifically interested in I don't know, I guess trying to kind of call us out, saying, well, what about all that stuff you guys did last year? Well, yes, it's real, it's there, and we will continue to make sure that, again, every single policy we make, that we can look through it through that lens. And let me just also say that I am so glad that we took the time last year to do this. Who would have thought that right now in 2020, that we would be here facing all of this? It's just, it's just extraordinary that at least we have done that piece and now can roll up our sleeves and do everything else. Thank you.
Thank you very much. Councilmember Jawando.
Thank you, Mr. President, and thank you for those comments, Councilmember Navarro, and I couldn't agree with you more. We are in a better position to do the work and to act urgently as this resolution calls on, because we have this framework starting in August. We will be presented with an equity impact statement with every piece of legislation starting August 1, and we will then have to act urgently upon it. And we are ahead of the game, so that they are totally complementary and related. And so anyone that suggests otherwise is incorrect. And we do need the executive to act urgently to get the regulations done. And then we need to take budgetary decisions. And as Councilmember Glaze said, we need to move forward in a systematic way and have a plan for each committee, a plan for each area. And that's why we hired Ms. Ward, and the work is beginning. And so it's totally consistent. I do want to address one thing, another reason why this resolution, and I'm so thankful to all my colleagues, is so important. Because there are some who suggest, and I've heard this as well when I introduced and sought to put this forward, well, Black people, they drink and they're not healthy, and they don't, take care of themselves, and they eat the wrong foods. And this clearly states we are not the cause of these disparities, right? It is racism at the root. And it's the systems that lead to all these inequitable outcomes. And so it's very important for us to declare that over and over again, because many people think it's individual action. You've seen that in COVID. Okay, there's obesity in Black and Latino communities, and that's why they're contracting. And that's been debunked. And so this personal responsibility narrative that's been out there and embedded in racism so long, we need to break that down. And say, no, it's these systems, these structures that lead to this inequity. And I think that's an important part of what we're doing here as well. So I just thank each and every one of you, and I look forward to the work ahead. And as Councilmember Hucker lifted up, I'm so glad he did, we need the state. I know there's movement in the federal government. There's other jurisdictions in Maryland that have asked about this and are going to move forward, hopefully create that momentum, because so much of this is tied in all of our state and federal systems and dollars as well. And so we need to say this nationwide and finally start to heal our original sin. So thank you, Mr. President, and thank you to everybody.
Thank you very much. This is scheduled, and it will be voted on next Tuesday, June 16th. We are, as I've already announced, going to postpone for the moment the district council session on the hearing examiner's report and recommendation on local map amendment H135. That will be done. We will have that district council session, immediately following the public hearings and before we receive a food security issues during COVID update this afternoon. The next item that we have is going to be hearing from, it'll be the council sitting as the Board of Health and hearing from Dr. Travis Gales over the COVID-19 situation. Dr. Gales, are you still here? Yes, I see your name. So, Dr. Gales?
Yes, I'm here. Sorry.
How are you? Welcome back. How are you?
I'm doing well, thank you. I mean, I will say before providing updates, being able to sit and listen to the conversation related to the public health issues. As you know, from our perspective, we've been talking about social determinants, social justice, health and all policies. So this is good stuff. And thank you all for being leaders. And if we can be of any assistance in terms of having the rest of the conversations, please let us know. We're happy to provide data where we can, and any other tools and resources that we have within our department to you all to help assist in that process. Now, with that in mind, I do have a hard stop at 12:15, but we'll go through really quickly to try to get updates in. Our numbers today, the state total is 59,000. And give me a second and pull it up here. I'm so sorry. The case count for the state is 58,904 and 12,968 cases for Montgomery County. And that includes a new cases of 150, which is down from the overall average we saw from several weeks ago. And the last 2 days preceding this were case counts of 110 and 84. Now, we hope that becomes our new norm, because that certainly would show significant improvement in terms of the daily number of cases. Now, we know that we are testing more and increasing testing capacity. And so to that end, the most recent state numbers as of yesterday, we've tested right over 74,000 tests, including 1,300 from the previous day. And we've tested 6.3% of the residents in Montgomery County. And our 7-day average for test positivity is 9.6%. As you know, that has decreased significantly from upwards of 30% in the mid portion of the pandemic. So it shows promising signs in terms of movement in the right direction. Additionally, our R naught value from June 5th was 0.97. I suspect that given the lower numbers in the past 3 to 4 days, that number will decrease. And once we get the updated number, we will share that with you all. So from a numbers perspective, and also looking at our data dashboard, we continue to make movement in the right direction. Again, what I am looking for is sustained significant decreases in our daily counts. The other number that and I'll pull this item up, that we had talked about before that gave a sense of pause was our surge capacity, particularly related to the percentage of acute care beds available in ICU usage. Now, we do still are running high on our ICU census. However, there have been a couple of strategies that we, along with the health systems, have put into place to address that. The biggest one with our partners at Adventist and their health center, as you know, have been working to increase the bed capacity at the Washington Adventist Tacoma Park site. As of the update yesterday, there are approximately 75 beds that have been added by the state. 26 of those have gone live already, and the remaining 49 are being finalized in terms of being stood up. And that is part of a total of 200 that they are increasing, working with the state to build that out. Now, the numbers on our dashboard do not reflect that increased capacity just yet. So as we stand, our acute bed percentage is around 70%, which is our goal. And we are confident that once we add those beds to the denominator, that will cause that percentage to drop even more. What's encouraging anecdotal evidence from Adventists in particular, they said that the impact of COVID-19 has decreased on their health system over the last 2 weeks. Again, we hope that continues and hope that's the case across all of our health systems. Now, what that does open up is, and how does it relate to ICU care, is if those beds can be used for lower acuity patients, that frees up space within those tertiary care centers to be able to absorb more and make more provisions for critical care coverage. So moving forward in terms of other items, just to bring you up to date, We did mention on our last call that we had invited a number of individuals to provide serve as an advisory panel to public health services, particularly as it relates to our metrics. And I know that I have received a couple of questions from a number of you all from community members asking if we have reached out to other folks. Let me say yes, we have reached out to lots of folks throughout this process at the state, at the national level. We've also looked at other jurisdictions in terms of gathering ideas for best practices in terms of how we move forward. And one of those suggestions was creating an advisory panel. I'm happy to say that everyone that we invited, which is a diverse group of experts in the public health and medical field, have accepted. And I can provide a list of those individuals to you all in email following this conversation. The purpose for those folks is to, again, help provide additional eyes and ears to make sure that we are looking at the right things and we are implementing strategies as best as we can and using the full complement of our resources and identifying additional resources to bring in to support those efforts. One of the things that we did do over the last several days is we recognize that we need to beef up and bolster our epidemiology and surveillance component, which we've talked about before. We did reach out to CDC to begin discussions about providing additional epi support to our team. We have had a couple of conversations this morning actually with their staff and have engaged the state to talk about how we can move forward in that aspect. I know last week I may have said aggressive, but we're using a very active approach in terms of driving numbers down. Because I don't believe that we should just say the number of new cases are here just because we're testing more people. Certainly, yes, we want to find as many cases that have been unknown before, particularly those that are asymptomatic, but we also want to make sure that we are interrupting as many networks of transmission as possible. And to that end, consistent with that, Dr. Liu, our epidemiologist, identified those top 10 zip codes, and Councilmember Navarro has already referenced this, identified those top 10 zip codes with the most cases, and also compared that to our previous report from about a year and a half ago that did the zip code analysis, ranking the zip codes on a host of health outcomes. Unfortunately, it should not surprise anyone that many of those zip codes that performed more poorly in that analysis also are the places where we're seeing more cases. So that it gives us more data points to make sure that we are doing focused interventions within those particular zip codes. And that's where the very active approach comes in terms of increased testing opportunities, increased contact tracing, increased outreach to those areas. Also, in the short term, but then the longer term is consistent with what you all just discussed, is those areas are disproportionately impacted by a significant number of social determinants that are driving the outcomes not only for COVID, but all of these other conditions that we know predispose folks to worse outcomes. And so we will continue to think through and strategize how to do that. And we're working with colleagues within HHS, across the government, the county government. And this is consistent, again, with the platform, the Health in All Policies approach that we launched last year, that is making sure that all agencies across the board are looking at the impact that their respective policies have on health outcomes. Now, the other thing I want to update on is the contact tracing component. I've mentioned before that we're working with the state and their platform. That was launched at the end of last week, and Montgomery County was brought online to that yesterday afternoon. And again, the benefits from that is it is a shared electronic platform. And one of the other benefits is that it is updating the state surveillance system related to COVID. So the old system, I made a joke this morning on a previous call that the old system was not that much younger than I am. And so that gives you a sense of it's pretty old, it's fairly old. That said, there's a new system in place, COVID Link, that is pulling the information directly from the CRISP system so that we can get the lab results as quickly as possible and folks are identified within 24 hours. Now, once we get more data points, again, I know as Councilmember Reamer's request some time before, we'll be able to answer that question in terms of what is the percentage of cases being closed within or identified within the first 24 hours, contacted quickly, and the number of relevant contacts that have been attached to that. So we're working to be able to present that information to you all on a regular basis to be able to answer that question. We have moved forward. We're making strides. In fact, during this conversation, our HR team has notified us that we're moving forward with working with the contract agency to bring in additional contact tracers to support the effort. And additionally, we've had a number of community agencies, for example, CASA, reach out to initiate discussions around how we can work together, not only in the area of contact tracing, but also in terms of increased outreach to do more transmission prevention in respective communities. So those conversations will continue this week. Trying to think of anything else really quickly. I'll stop there, but happy to answer any questions that you all have.
So let me, because you have a hard stop at 12:15, I have two council members that would like to speak. Councilmember Rice and Councilmember Reamer. Are both of your questions to Dr. Gales? Councilmember Rice, yes, and Councilmember Reamer as well. So what I'm going to do then is ask you to ask their questions, since he has to go at 12:15. And Councilmember Rice, you're the first person.
Well, thank you very much. And so, Dr. Gales, thank you for this update. My concern was around the acute care bed utilization rate. And that's something that's been kind of a holdup for us when looking at the COVID dashboard. And I certainly understand about the adequate capacity piece, and adding that will certainly help the denominator, which will help our percentage. But I am concerned that if we still have the cases that seem to be going down, why we still have such a high bed utilization rate. So if you could talk about that and talk about, are the cases like more significant that we're having? So even though they're lower, are they more significant, resulting in hospitalization? And that's why those seem to stay solid while the cases go down. So if you could just address that.
Sure, excellent question. So the differentiation is that even for the folks who are coming in with COVID-19 who don't require critical care, their time in the hospital is a little bit longer than average. So, they're not coming in and leaving within 2 days. So there are folks who may be there for a while, and their convalescent period isn't a short turnaround, even if they don't have, the most severe symptoms that require, critical care, ICU type care. So that's a big component. The encouraging signs that within that additional context is we've seen a significant decrease in the number of folks going to the emergency room and seeking health care for COVID-related illnesses. So the number of folks going into the hospital with COVID-19 is decreasing, and a large part of it is, again, those folks who have been in there for a while is making sure they improve their symptoms and are able to be released to come back home. Now, that said, certainly we still, I want to make sure folks at home understand that when we're saying numbers are improving, that doesn't mean everything is open, we're ready to go. It gives us a sense of optimism that we're moving in the right direction, but still, to your point, we would want to see a bigger decrease in utilization, certainly for the folks going in as well as the folks there being able to come home before we move forward.
Thank you for that. And then just very quickly, World Health Organization just shocked the world with their statements about asymptomatic cases. I've already heard from epidemiologists and doctors across the world who have said that they vehemently disagree with where the World Health Organization is coming from a small study out of China. If you could just address, because we know that we will now have constituents who are calling us saying, well, the World Health Organization says you can't get it from asymptomatic people, so therefore, why are we worried about this? Could you please just address that as quickly as you could?
Sure. Well, I think the World Health Organization is most likely going to have a press conference today or release a statement that clarifies their comments from yesterday. We know that asymptomatic carriers can transmit. We know that that's probably one of the reasons why our nursing home facilities and assisted living facilities have been hit so hard. And I don't make decisions on one data point. And so certainly we would want to see more information or other studies, larger studies that will provide that evidence. But everything that we know right now suggests that there is potential for transmission. There may be lower potential versus someone who has active symptoms. But the reality is you can still transmit. And so as a result, we as a jurisdiction, consistent with, I'm pretty sure, everybody across the country, are not making any changes to the recommendations or provisions that we have in place.
Thank you very much. Councilmember Reamer.
Thank you so much. So I wanted to follow up quickly on testing and tracing and isolating. Thank you, Dr. Gales. Can you share how many tests are we conducting now per week? What did we do last week? What are we going to do this week?
So let me pull it up. I can send this to you offline. So the state sends us a daily total of the number of tests. It's not a day. They send us a daily update of the total number of tests that have been performed. And now this morning was the first time where they broke it down in terms of the number of tests per jurisdiction for the previous day. And so what I can do is break that down and show you. So for example, we had approximately 1,300 tests from the numbers were updated yesterday. So 1,300 tests from the day before. And so that's for the jurisdiction. Now, as you know, we've talked about and are continuing to push. And when I say push to get our high throughput option out, that would allow for us to do multiple thousands of tests on a daily basis, so that we are testing over 10. We're putting out over 10,000 tests a week to be able to get there. I can tell you, and I'm sorry and unfortunate that I can't say that is moved right now. I can tell you that is being pushed. That would allow for that high throughput test to get those numbers up. Now that said, as we work those out, our team internally, their homework assignment and task this week has been to come up with, to say, while that gets worked out, how can we further maximize what we're doing and get out to, for example, one of the strategies that we've identified these 10 zip codes is to be able to get out and do some pop-up testing. Create provisions where folks are able to potentially walk up, not need a referral, and get as many people through as quickly as we can and make sure that we have a robust system in order to be able to get them their results quickly. So I say all that to say that I can provide you with the update based upon the state numbers, and we'll keep you posted as we continue to push.
Okay, thank you. The state numbers include the private sector's component as well as the county administered, is that correct?
Yes, so it's anyone technically, or it's the results that have been resulted within Montgomery County zip code.
Okay, so the advogenic, it sounds like the high throughput option is still in, it's close, but it's not there yet. And I appreciate your emphasis on pushing hard. We need to push. I know you believe that. Mm-hmm. I do wish we had been executing on the traditional PCR testing model more. It felt to me as though we were anticipating the imminent arrival of the high throughput, and so we didn't ramp up the PCR as much as we could have, perhaps in retrospect. So did the pilot happen on Friday then with the county employees?
Yes, so we did do a soft launch pilot, and forgive me we tested 40 folks, and that information has gone through. I believe that was sent on Friday. I know that yesterday they were working on making sure that the lab system talked to the state system so that the electronic lab reporting could be done. So just really briefly, Geek Talk is, when a lab runs a test, there's two types of notification. You get it directly as the patient, you and your provider get it, and then if it's a reportable disease, it's fed directly into the state surveillance system. And so when it results, we've got to have those two. So you get it as the individual who ordered it or the patient, and then the surveillance system gets it, and that's how we pull it as the local health department to be able to follow it. And so they were working on ensuring that information was transmitted smoothly and seamlessly as of yesterday evening. And so again, that did go well, and kudos to the team for moving that forward, and that will hopefully allow us to launch it and spread it out even further.
Thank you. On tracing, I heard you say that you're going to get us a report soon. Can I push you here? Can you give me a date? Can we have a report by Friday?
Well, so the reticence on a date isn't necessarily just not wanting to put a date. We literally just were put onto the system yesterday. So the system was up yesterday. The system's there. So what we will try to do is get you as of Friday, say, here's based upon the 4 days.
Give us what you got.
Gotcha.
I understand. This is an iterative process. I'm totally okay with an iterative process.
Okay.
But I'm fascinated to see, and I feel like getting the reports going will also be supportive of getting operations going. I'm pleased that you commented that you're talking with CASA about potentially expanding the tracing team. I think that's really welcome. I've heard from a number of our community health partners and the nonprofit sector that they would be really eager to provide support into our tracing operations. And I think a lot of the nonprofit sector staff is probably quite competent to do that. Does that also imply that the state contract with the NORC, that we're identifying that it's not going to be enough, that we're going to have to go beyond that?
Well, so well, I guess some could rely on that. I don't want our jurisdiction to just rely on that. I think we've got to have a robust infrastructure here to be able to support what the state is doing, but also go the extra mile. Because I think there, much to your comment about how there are nonprofits and other agencies who are known in the community, I think there is an important element about proximity. We've got staff here who live here. They work here on a regular basis. They understand the dynamics, so they may be able to add a more personal element to being able to provide that outreach. So the goal is to make sure we've got adequate staff in place to supplement what the state is doing and not just, defer to the state and say, NORC, you do everything and we're just here to wait for you to tell us what we need to do.
Okay. Well, I'd like to see more in this arena. I mean, when we get the reporting, I think we want to see what happened with every case and then with their subsequent contacts.
Sure.
So that's been the goal all along. We've been waiting for COVID link, the database to come online. So I think it's time to grow from there. Final question about isolating or quarantining. Can you talk about who will be who will use the quarantine space that we've secured, and how will the outreach be conducted in order to bring people in?
Sure. I see Dr. Crowell also online, who's been actively engaged in those processes within HHS, who can provide some more insights to that. But I do know that it's been as part of, when folks are identified and test positive, part of that conversation is saying, what are your provisions and ability to be able to isolate and quarantine effectively? And so within doing that screening process, if folks are saying, I am in a high volume household or congregate living situation, here is a number you can call, or here's a resource that you can call to be able to utilize that space to, again, prevent further spread.
Okay, so it's happening through the tracing program. And good. I would appreciate knowing how many people are in that space just on an ongoing basis, and including that in the tracing report. Okay, thank you. Again, if there is anything that we can do, to me, this is the most important thing we could fund. Of all the things that we've spent money on so far, nothing would be more important than spending money on testing and tracing and isolating. And yet we have not yet once had an appropriation request for any of those. And I think, if money is an issue, we could hire 1,000 people now to supplement your efforts. So please, tell us what we can do to help you move fast and support reopening, because we're never going to be able to reopen successfully, as you know, without a strong executing program in all these key areas. So thank you.
Thank you. Though I didn't put a 5-minute rule when we do have a hard stop for Dr. Gales at 12:15, and we have at least 2 other speakers at this point. Councilmember Albornoz.
Thank you, Mr. President. I'll be under 5 minutes, but I can't miss this opportunity. Just a point of privilege. I can't think of a better person to address us at the beginning of the session today than you, Dr. Gales, for every reason imaginable. So thank you, sir, for your leadership in so many different areas. I just want to state later this Thursday, the HHS committee is going to do a deep dive into the GO teams that you described in your opening remarks to talk about both the work within those zip codes, but also in our group homes and an update also within our nursing homes, because there's similarities in some of the approaches, but obviously a number of unique elements in each one. So I will defer those comments. But I did want to talk about this. Our faith-based organizations have done an incredible job to date in adhering to all of the guidelines that we have issued and have showed tremendous patience and restraint to make sure that their various congregations in so many ways get through the pandemic. We are, not surprisingly, as in so many different other key and critical areas, feeling anxiousness and anxiety because of all of the tough elements that all of us are addressing right now. So many people want to turn to their faith to help process and address and deal with everything related to the protests, everything related to the pandemic, everything related to the economic frustration that people are feeling right now. And so this question goes to both you, Dr. Gales, and Dr. Stoddard. I know the answer, but I want for our public to hear why it's so important that we continue to be diligent and acknowledge and own that there is frustration when people are seeing the mass gatherings and protests that the county has organically, maybe not formally, but supported in some way. And why are we allowing these protests to move forward, but not allowing congregations and other sectors to come together, particularly as it relates to outside services? And I do want to I do have a specific question. There are very unique and intimate elements within each faith that are core to its principles and beliefs. And the receiving of the Holy Communion is one example of that, and there are many others, which provide a very important layer of information for us to think about as we do the reopening. And there are some faiths who have felt that the guidelines we have set are too ambiguous and don't specifically, to the degree to which they could, address some of those very unique and critical components to these many faiths through their very important components. So sort of a broad question and statement there, but wanted to defer to you to make some comments on those concerns and issues that we have received recently. And then Dr. Stoddard, if you have anything you want to add to Dr. Gales's comments, I would appreciate it.
Sure. Again, excellent question. And so I will just segue one comment on the nursing homes. We have met with our researcher from GW who's been working with us on that. And we've identified the nursing homes with the high number of cases and recent cases, and we're doing some remediation work with them. So that's one thing I want to put out there. As it relates to the other components with faith. So we recognize there's lots of tough decisions, and then it's frustrating because there's lots of different religions and different components to things. And we actually had a long conversation with a religious organization last week. We met with them on Friday to talk through their proposal and their ideas in terms of how they could potentially move forward in executing some of the things that you just mentioned safely. And we are working with our other jurisdictions, neighboring jurisdictions, to talk about how we could potentially do that, what that looks like. And part of the challenge is this, activities carry different levels of risk. For example, there was a recent EPI study that looked at different types of activities and the risk associated with it. And due to the quality and the nature of interactions that we have in our religious spaces, that unfortunately religious type activities score very high on the risk factor compared to some other things. And so the reality is, while there are unique differences within each individual group, the policies are broad to kind of provide as much coverage and safety as best as possible. Now, I will say this, as we move forward, Again, we've had some great conversations and engaging some of the members of one particular community. We look forward to engaging others to learn more and find out more about different activities, how we could potentially do them safely. I know that as we move forward from phase 1 to phase 2, there will be more allowances in terms of the space that's allowed, the type, the number, and the capacity that's allowed in those different activities. So we appreciate the patience. We are continuing to think through different strategies to keep everyone safe, but also make sure that they do have some access to the types of activities that would provide them some sense of faith and support.
Thank you.
I would only add that, as Dr. Gales alluded to, we are looking at this as something as part of phase 2, and there are very faith activities have potentially some very important areas where we're going to have to provide some more specific guidance, and we recognize that. A lot of the early spreading events for COVID-19 did take place not just in the United States and not just regionally, but across the world. Many of the early events that were what we refer to as super spreader events were faith-based activities because people tend to be in very close proximity. Things like singing are likely to express more virus than just conversation, intimate contact. When you, for example, we've had even detailed conversations as you talked about the Eucharist, whether the priest will place the Eucharist into the mouth of the congregant, and things like that. We got into those level of specific details only because obviously different activities that are very much a part of our faith traditions can be riskier than others. We want to make sure that when we open that space up and allow for those activities, that it doesn't become a high-risk environment to the extent that we can control it.
Thank you.
Thank you. Councilmember Friedson.
Thank you for that. I just wanted to echo Councilmember Albernaz's comments. Appreciate he and I have had some conversations with faith groups and leaders on these very issues. I just wanted to echo everything that he said, and I would hope and appreciate that. And I know this started last week, as you noted, on Friday, but all observances aren't created equally. They're done differently. And I hope that as we move forward and as you determine that you can work with the individual faith communities based on the specific observances that they have to mitigate the risk. And what I have found, and Councilmember Albernaz could echo this as well, that there's a real interest to work with the county and work with the public health department to be able to mitigate that risk, because they want to keep their congregants safe as much as we want to keep our residents safe. But there also is a real need to turn to faith for those who observe at a time of great stress and anxiety and uncertainty. And I do think it is a mental health issue for many people in our community, and that outlet is really important. So I hope that as we look at doing that we can be proactive, be collaborative, work with them, and figure out how to mitigate the risk and allow what we can in a way that is appropriate and that continues to keep our residents safe. Also echo what Councilmember Reamer mentioned about testing and tracing. Certainly agree with that, and I will reiterate that we're here to help, and we're ready to partner to be able to ramp up those efforts. Certainly something that we're hearing from all of our constituents of where we are on that, and all of us, including you, we know, would like to see more urgency and more progress on that. I know you're working really hard on that. And I particularly wanted to note Councilmember Albernaz took my comments on the appropriateness and the significance of the recognition earlier, and just wanted to associate myself with those comments that were very well deserved, and appreciate the fact that in so many different ways having you lead us on these issues at this critical time has been really great for me personally, for our county more broadly. My question. So as of yesterday, 7 of 9 metrics have been hit over the last 14 days that are on the data dashboard. From what I can tell, you mentioned today some of the significant progress that's being made specifically on the acute bed ICU issue with the addition of the Adventist additional beds, as we've talked about quite a bit, which I appreciate. So in light of that, what would need to happen over the next week, over the next several days, specifically in order to move into phase 2? What are you looking at?
Sure. So I think one thing to clarify, thank you for your comments. So one thing to clarify, and we can clean this up from a dashboard perspective, is that we would need to see these measures. I know it's saying 14 out of 14 days, but it would be 14 days within phase 1. So we moved into phase 1 on June 1st. And consistent with CDC and the state's approach is before moving from one phase to the next, you should see demonstrated changes of 14 days. And so we got to change the numbers a little bit to reflect the 14-day period from when phase 1 started. Now, the way the numbers are moving is it's every indication that they're moving in the right direction. So what I would want to see is evidence to suggest that this positive movement has sustained, not just simply plateaued, but is continuing to decrease and sustain. And I think those are the indicators that would give us the opportunity to review and evaluate to say, hey, we have, we're coming up on 14 days or we're hitting 14 days and we've seen that and would be able to potentially move forward to phase 2. Or worst case scenario, say, hey, we haven't quite hit all of the indicators in a way that we want, particularly seeing a sustained decrease in the number of new cases to suggest that the load of the virus has decreased significantly in the community, because as you know, the activities that we have talked about in phase 2 differ from phase 1 in that they are introducing more increased points of contact. So I say all of that to say that if we get to the point, in 14 days to say, we've got some things that still give us pause, we would, I would, from a health perspective, provide guidance to say, there are potentially some activities that may be lower risk that we could move forward safely in the absence of saying, here is all of phase 2, moving forward. Does that make sense?
Yeah, it does, although I'm a little confused as to the 3-day average piece of it, because I thought that we're really comparing 3-day averages, not just the individual days of improvement. I thought that was part of the reason why the CDC has rolling averages.
So we are. So when I'm referencing seeing decreases, we're saying, I'm looking at the 3-day average and I'm seeing decreases in that sustained over time. And averages are informed by, even though I'm saying it's a daily average that, on the dashboard, I'm seeing decreases in the 3-day daily averages when I'm seeing decreases in the daily count. So, for example, the 3-day average from the last 3 days from 110, 84, and 150, that 3-day average is going to be significantly lower than the 3-day average before that, because we had one day where there were 300 cases. So it's not an either or, it is collectively looking at it because one influences the other. So we're speaking the same language.
Sure. And then as a follow-up, moving into phase 1 was announced on a Friday, and then the following Monday we'd be at 14 days. This upcoming Monday, do you expect a similar timeline of that type of announcement, few days? I know there's been some talk about announcing a little earlier to provide more time for the transition. I know there's an interest to announce what phase 2 and phase 3 look like, and hopefully we're going to see that publicly shared soon. But could you just share, when you would expect to make the decision and when you would expect it to take effect?
Sure. Well, I think again, the earliest 14 days would be on Monday for us in terms of moving to a new phase, and that would be consistent with the dates that our colleagues in Prince George's County and DC have mentioned. I think Prince George has mentioned that they would reevaluate on June 15th, and DC would do the same around June 19th. All are dates. These are dates next week. So I think what we have to do is continue to see how the numbers go over the next several days, and then that will at least determine, at least from a health perspective, the guidance that I would provide, to the CE's team in terms of being able to move forward. I would suspect that the approach to moving from phase 1 to phase 2 would be similar to the approach that was taken to move to phase 1. And I will say that based upon the calls that I've been on, is that different teams have been actively engaging the business community around what some of those things might look like, and in terms of the types of things that they need to do to prepare for a phase 2 reopening in some capacity.
Thank you.
Thank you. Councilmember Jawando.
Thank you, Mr. President. And Dr. Gales, I also want to just publicly thank you for your work on not only through this crisis, but in assisting and being in conversation with me as we were developing the resolution declaring racism a public health emergency, and the report that you all have done and the work you continue to do. I'm really excited. I know we can tackle that with you and with Councilmember Alvarez and HHS and with our whole team. So, and Dr. Krause, because I know this is something that's important to him as well. So thank you publicly for that. Just two quick questions related. When people hear we've tested 6.3%, and I think hopefully I quoted you right.
That's correct.
Okay. That means they've been tested one time, correct?
It's the number of people tested. So we've tested at a minimum one time, yes. So there are people. So we've done over 74,000 tests of 63,000 residents. So yes.
Right. And could you explain the relationship? Because one of the questions I've gotten and I've had myself is obviously with the demonstrations, we've had over 57 here in the county, and just with general as phased opening happens, people have the potential, and we get more testing capacity. How that number jives with the potential for people to have been re-exposed or exposed, and how that testing works. How that number works with that reality that you have people out there that may have tested negative, but now potentially as people start to come out and about in the protests in particular, how you're going to be looking at that.
Sure. So retesting is an important component. And to one of the points that Councilmember Reamer brought up earlier is that, for example, essential employees and first-line responders will need to get tested on a routine basis because you may be coming into contact, as you just mentioned, and exposed to different things. So that's part of what we're factoring in terms of our testing approach to make sure that we have less invasive options available for folks to be able to do that multiple times. And it also underscores with the shift in the criteria. I think, in the beginning there was not an embarrassment of riches, so to speak, in terms of tests. There was a great paucity, and so limited number of folks were being tested. But now with the advent of more PCR-based tests, both from a nasopharyngeal perspective and other mechanisms being introduced, that creates more capacity. And also the thing that we haven't talked about, which we are still trying to figure out and how to best use, is serology testing to see if an individual has a markers to suggest that they had the infection previously, even if they didn't know.
Okay. And then the last question quickly is, the sites, as we get to more broader testing, have you envisioned, and forgive me if I missed this, having additional locations in addition to the locations that might be shutting down, where you're going to be having new opportunities for people to get testing through the county?
Yes. So the goal is actually to, I don't know if it's the best analogy, but to tear down the walls of testing, to make it available. So this idea of doing more pop-up style based testing, where we're taking the test more to the communities, so that people have more access points. And that is because, we have increased capacity with, a mobile testing arm, as well as increased testing capacity. It also, with less invasive mechanisms, introduces the idea where other types of venues that probably would be more difficult to use if you had PPE involved and nasopharyngeal swabs could be introduced, and we can get a large number of people through it fairly quickly.
Okay. Thank you. Again, thank you for all your work.
Thank you, and thank you, Dr. Gales. You're a whole 6 minutes early when you had to leave. And so I guess the next speaker, or Dr. Stoddard and Dr. Crow, did you have things to add to this today?
Yes, I have a couple things, and I have a 12:30 meeting that I have to get to. So I don't know whether Dr. Crowell has additional items as well. I can hit my items.
I do.
Mine's like a few minutes.
Earl, why don't you go ahead? I'll finish up. I'll wrap up. Okay. I'll go
Okay, I only have like 5 minutes or so worth of things I want to hit. We are continuing with our PPE distributions and our cleaning supply distributions, particularly to our essential childcare providers on the cleaning side. With the initiation of phase 1, there were over 100, almost 150 additional essential childcare providers that the state has permitted to operate, and obviously they can operate supporting the essential workers that existed before phase 1 as well as what was added in phase 1. We continue to provide them support through our provision of supplies for PPE and cleaning supplies. We also have done group homes, private healthcare providers, nursing homes, and assisted living facilities over the last 10 days. We've done additional distributions. As you will know, ride-on service has escalated as well as we've gone into reopening. They opened their Essential Services Plus service on Sunday. We're up to 53 weekday routes, 49 Saturday routes, and 42 Sunday routes. For the 311 call center, we had 381 COVID-related calls yesterday. 51% of that 381 were for the EARP and HHS rental assistance program. And of those calls, there were 85% of them to the Spanish queue. So while we've seen a reduction in the total number of calls coming in on EARP or the rental assistance program, they still are consistently highly being sought after in the Spanish language queue. And so that's been a constant. As it relates to reopening, we did, Assistant Chief Administrative Officer Jerome Fletcher did launch a MoCo for Business podcast last week. We are working on future podcasts being translated into other languages, so that's more to come on that. In addition, I'm meeting with Ms. Ward tomorrow, and we're talking about how we're going to build in racial equity into our recovery framework in every single working group that we do. And so I'm working very closely with her to make sure that we can build in all of those. We did some things early on, but obviously we want to step up our game as well. And so we're going to be working with her to identify what additional training, what additional structural elements we need to build into our conversations to make sure that we're reflecting that practice in our recovery effort as well. And then finally, we did launch our ambassador program. For those who don't know what the ambassador program is we're working with the Department of Housing and Community Affairs. The inspectors that had been on administrative leave, we've brought back to go out and do work with our businesses in the community to make sure that the businesses understand how they can effectively operate in this new environment that with additional requirements that help keep public safety or public health practices in place. And so we've visited since Sunday 282 businesses. What we've found generally is that most people are doing exactly what they should be doing. And, we've noticed some very innovative measures that businesses have implemented. And we're going to try and build an FAQ out of our experiences with what we've seen businesses doing that can be shared with other businesses. We're also looking at a business resilience center is I think what we're loosely terming it based on our conversation so far, about how we can provide additional technical assistance to businesses that are opening, as well as how we can help them survive during these incredibly challenging times, whether it's lease renegotiations, things of that nature. And so we're more to come on that as well. Where we are seeing challenges with our businesses are largely in the discrepancies that exist between what the state allows and what the county allows. And that continues to be something that we've got to do more messaging that gets out to our businesses so that they understand exactly what the requirements are for them and what can and cannot be open and how they have to operate in Montgomery County that may be, in some cases, different than how the other businesses across the state will operate. We know that that's, something we have to, if we're going to have different standards, we have to make sure that people are aware of them. And again, as a reminder, these ambassadors will not issue a citation under any circumstances. And so if they find something that's an egregious violation of an issue, they'll follow up with the business to work with them. In many cases, we've provided PPE. So if we find that they're not utilizing PPE in their business, we actually provide it to them as opposed to just citing them for it. And then we'll schedule a return visit, make sure that they're operating safely. We're not expecting this to be we're looking for voluntary compliance here, and that's reflected in the fact that they will never issue a citation. If we do find a business that's, repetitively having the same issues, then perhaps licensure and regulatory from HHS will be asked to come in and do an inspection. But again, our goal here is to provide the businesses with the information that they need to operate safely, have them do that, and we all are happy with that. So I will stop there.
Okay, Councilmember Rice.
Well, thank you very much, Dr. Stoddard, and I really appreciate that last statement because it's incredibly important. I know my office reached out to you about a business in Germantown that was operating, and there were questions about whether or not it was doing all the things that were appropriate. And folks immediately responded and said, hey, why are folks snitching? Why are folks, telling on these businesses? They're just trying to live their livelihoods. And while that's true, what we also want to do is make sure that businesses have the information. They may not have known and may have been confused, right? Because we understand that happens. And so this isn't about a Gestapo organization coming in and shutting a business down and finding people thousands of dollars in the midst of COVID. That's not what this is about. This is about really educating folks on how to best ensure that the safety of all of our community is upheld to the utmost. And so I really appreciate you highlighting that, because I think folks are confused. And now I hope and I encourage folks, if you see something that you think may not be appropriate, just make sure that you reach out and let us know so that we can reach out to the business and ensure that they're doing things the right way. That's what we want. That's going to slow and continue to keep us going in the direction of really minimizing the number of cases here in the county and get us back on track. If these businesses aren't doing that, the counter is that then we have more rampant cases, and then we have businesses that continue to stay closed. So let's all help ourselves to be good partners in our community. And so thank you, Dr. Stoddard. That point couldn't be more well emphasized in terms of where we are, in terms of our strategy, and especially encouraging our businesses to be very good partners with us, even though they're open and they want to jump to the next level or the next phase. Let's take this in stride and make sure that we're doing things the right way. So thank you for that. Thank you for your leadership, and thank you for your follow-up. Appreciate it.
Thank you. And I guess it's Dr. Crowell. If you had some words to tell us, please.
I do. Good afternoon, folks. And I thank you. And I won't keep folks long because I know you've got to be back at 1:30, but there's a possibility I may not join you. So I wanted to say a couple of things to you all. The first thing is I want to back up and talk about this issue of racism for a little bit in this context and say thank you for introducing the resolution declaring racism as a public health crisis. It kills, and it is death by 1,000 cuts, large and small, stress, ACEs, mental health, substance abuse, suicide, and homicide. But this crisis is a chronic crisis, both subtle and overt, and it cuts across all of our social determinants of health: housing, food, employment, agency of individuals, academic access to health, transportation, and of course in policing. The outcomes we see from deaths due to COVID-19 to the deaths of George Floyd, these are not accidental or statistical anomalies. America as a country chose this path of racism. 400 years ago, they chose it. It's been chosen off and on over the centuries in our laws pre and post slavery. And we are still making this choice of racism and the protection of white privilege as a priority. And that is what we're fighting against, I think, in this moment. I took a break 2 weeks ago from COVID-19 and turned on the news, and what I saw was George Floyd's life being taken from him. And like the world, what struck me about that was the casualness, the indifference of a man with his knee on the neck of a black man with his hand in his pocket, as if he were, stepping on an ant. And I think that is what shocked me and shocked the world into action around this. But that indifference, I think, is trained into each of us. And we're trained in a lot of ways to accept this as a norm. Racism is like the salt in the water that we swim in. It's a part of us, it permeates us, and it shapes how we see the threats and how we respond. And sometimes we don't see it. I've listened to all folks talk about use the word systemic a couple of times, and I want us to understand that each of us are that system. We are that systemic process. Those who have the power to make change, to speak truth to power, and the choice and the option to look away. So it's all of us sitting in this room. There is no system absent the people who make those decisions. You know, there's a conversation that you hear about the social contract of America, but I don't think that there was ever a contract with Black America. So I would argue that it's time for a true social contract that's built on justice and full inclusion of America, that is reflected in our laws, in our budgets, in our speech, and in our policies, and in our service to the communities, not just at the national level, but right here in Montgomery County. This moment, you know, when the world is watching and saying enough, has given me some hope in ways that I still am filled up by. But I think that hope is only going to be sustained by what we do when the cameras are off and when the world is not looking at us and not commenting on it day to day. And that's going to be our challenge going forward, I think. And I think we have an opportunity to do that. And I'm glad to hear you all signing on to that process. To that end, in terms of this conversation about COVID-19 and where we go from here, you know, Dr. Gills has done an excellent job of leading that process and working with us to try to guide us. The data from the EPI team that you all received this week on the impact of COVID across the county, I think is just a start. And our task across all the human services is now to dig a little deeper to see where within the zip codes those impacts are greatest, who lives there, and how we are touching their lives now, and how we are going to touch them. And more importantly, who we are not serving, because I think we have pockets where we don't touch, that have been impacted. And I think it's time now to get to them and to learn where they are and to learn what their needs are. And that's not just an empirical data question. It's data from our community partners, and I think that's essential data as a step to partnering with the community and reaching out into the communities. So as Dr. Gills talks about ramping up broad-scale testing and contact tracing, we are also ramping up the human service support piece of that for the folks who have tested positive and for the folks who are economically impacted by this as well, to try to address the trauma and the fear and the social services needs. That's part of the work that has to be blended with testing and will follow our efforts on into recovery. I know we'll be talking about this again as we talk about GovTeam, so I won't dwell on that now because I know that'll come back up again. But I wanted to let you know that this is that I appreciate the work of council and their attention and support in the last 8 weeks, 10 to 12 weeks, and in the year ahead. We're going to need all of that support and then some. So I'll stop there and let you all wrap up and do what else we have to do next.
Thank you, Dr. Pearl. And let me just say on a very personal level, thank you for your words beyond what you do for COVID. But this morning's your statement really brought it home to all of us. Councilmember Navarro.
Thank you very much, Mr. President. Dr. Kroll and Dr. Stoddard, and of course, Dr. Gales, who's had to leave. Again, thank you so much for being the leaders, specifically during this crisis. Just a brief comment to say that you're spot on. I think, Dr. Kroll, we've had some really robust conversations about reimagining and really taking stock of the assets that we have here in the county, because we do have a lot of, I think, assets and models that have served us very well. But as you said, we aren't all part of this system. And that calls on us to also very quickly take stock of those models and those assets and begin to reimagine them and deploy them immediately. This pandemic especially has, in my opinion, brought all of us to this point of not having the luxury to look away or talk about possible next steps or talk about, hey, the plan, and hey, the 5-point action plan. I think that what we are facing right now, it's a moment of reckoning where we have got to do it all and we have to do it immediately. And, I know I have sound like a broken record throughout this pandemic and all the meetings, but the truth of the matter is that those zip codes and those communities, we know, have absolutely taken the brunt of this pandemic, and we owe to them and to the rest of our county residents to quickly make sure that we are building that capacity, that we're responding, and that we're doing it not just for the pandemic, but for the long run. And so just really wanted to acknowledge what you just said. want to publicly thank all of those nonprofit organizations, county programs, and community leaders that all came together and literally rolled up their sleeves and said, I'm just going to step up and do something, right? And I have appreciated that so much. But we all know that that will not be sustainable unless we build in, as you said, pretty much a new structure and a new system. And I look forward to working with you, Dr. Sauter, Dr. Gales, et cetera, to ensure that these particular structures and systems are there, so when the next crisis does hit, we can rest assured that we are ready for it. So again, thank you very much. I know this has been such a trying time and continues to be, but I am hopeful that we can definitely make some changes here that will be long lasting. Thank you.
Thank you, and thank you all the doctors that were here this morning, some of whom have already gone, but Dr. Kroll is still here. But thank you for being with us. We are now going to take a recess. As was mentioned before, when we come back at 1:30, the first things we're going to do is have the public hearings. And then we will go to the district council session on the hearing examiner's report and recommendation for local map amendment H135. And then we will have an update on food security issues during COVID. And then, of course, we're going to have a proposed closed session as well after that. But we are adjourned. We are in recess until 1:30. Thank you very much.
It was in Basel, Switzerland. There was a neighbor of Mr. Bishop's who lived right down